Hi everyone, in this video I am going to explain about 11005 CPT code, that is debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing tissue, infection, abdominal wall with or without fascial closure. So previously we have seen 11004 CPT code, right? So that is the debridement for the external genitalia and perineum. So whenever only for those specific location there is debridement, so we will bill 11004. So for infected necrotized tissue of the abdominal wall, we have a specific code, that is 11005. So debridement of this abdominal wall, we have to code this CPT code. So abdominal wall is nothing but it is the cavity surrounding the abdomen. So it is the muscle covering the abdomen. So what exactly physician will do in this procedure is, see, this is the abdominal wall necrotized infection. So this is the abdominal wall. So what physician will do is, first he will prepare the patient, he will give the anesthesia, and then he will evaluate the extent of the necrotic tissue in the abdominal wall. He will see the extent, to what level the dead cells are there in the infection. So then after, what he will do is, he will resect and he will debride. That is, he will slowly cut the, that is by using the scalpel, or scissors. What he will do is, he slowly removes the necrotized infected tissue, that is the dead cells. He will remove the dead cells from the abdominal wall with the help of scalpel or scissors. So till the level of the fascia, that is after the muscle, subcutaneous fascia, till to that level he will remove the necrotized tissue, infected tissue from the abdominal wall with the help of scalpel and scissors or some other tools. So until to what level he will do is, until there is a healthy tissue, he will remove the debridement, that is he will do the debridement. So after that, what will happen is, he will control the bleeding. So there will be bleeding, right? So he controls the bleeding, and then he also places some drains around the wound. He places some drains, so that if any pus or fluid is coming out, so from the drains, that will be getting out from the drains. And also what physician will do is, he applies the antibiotics to the wound and also packs the wound with the saline soaked gauze. The gauze he will apply to the wound, which is saline soaked to the wound, or else he may keep open also. And then finally, sometimes what physician will do is, the fascial layer will be there, right? That is the after the muscle layer. So what he will do is, he will close the fascial layer, or he may not close the fascial layer in the debridement of the abdominal wall. So in this, what physician will do is, he will see the extent of the infected area, and slowly with the help of the scalpel and scissors, he will debride, that is he will remove the dead cells from the abdominal wall till the healthy tissue or good blood is coming from the wound. And then finally he applies antibiotics, he packs the wound with saline soaked gauze, and finally what he will do, he may or he may not close the fascia layer of the abdominal wall. So this is the debridement of the necrotized tissue of the abdominal wall. So whenever a patient is having the abdominal wound infected, that is necrotized infection, and physician is performing debridement, so we have to bill 11005. And one more point also I want to explain here. So we have 11004. This is the debridement of the external genitalia. So I'll explain clearly. So we have seen 11004. This is the debridement of the external genitalia and perineum, right? 11005 is for the abdominal wall, right? So debridement, all these are the debridements, right? So for specific location we have specific code, external genitalia and perineum 11004. 11005 is for the abdominal wall. Suppose if all these 3 locations patient is having the wound and physician is performing debridement, so we have a separate code for that is 11006. This is the debridement of the external genitalia, perineum as well as the abdominal wall. So we have to build this, only one code is enough. If suppose only for external genitalia or perineum exclusively, so only 11004 we have to code, and exclusively for abdominal wall we have to code this one. If all these 3 are performing on a patient, only one single code, that is 11006 is enough. So like this we have to code the debridements of the particular locations. So this is the debridement procedures, few debridement procedures. So we will see few more debridement procedures in the next video. If you like the video, please like and subscribe to my channel. If you have any queries, please query. Thank you.